Almost half of our waking hours are spent in the workplace, yet the quality of the workplace is a major factor for a healthy workplace and reducing stress and burnout. The current thought process is to do more with less, which adds pressure on the staff and the management. A healthcare facility may be one of the most dangerous work environments in the United States. Threats to safety in the workplace vary from one setting to another and from one individual to another. Potential hospital hazards are biological, chemical, psychological, physical, and environmental, mechanical, or biomedical. No worker should feel uncomfortable or unsafe in the workplace. Agencies that developed guidelines to reducing risk are Occupational Safety and Health Act or Association, also known as OSHA. Then we have National Institute of Occupational Safety and Health, known as NIOSH. American Nurse Association, also known as ANA. Joint Commission, and the Institute of Medicine, also known as IOM. So throughout this lesson, we're going to discuss potential threats in the workplace and the skills needed to address these safety issues. Let's talk about violence and the categories that fall under violence. Some of the factors of violence are threats, physical assault, muggings. Behaviors indicating a potential for violence are a history of violent behavior, delusional, paranoid, or suspicious speech, aggressive, threatening statements, rapid speech, angry tone of voice, pacing, tense posture, clenched fist, tightening of the jaw, alcohol or drug use, male gender youth, or policies that are set unrealistic limits. So how can we prevent violence? Well, we can participate in or initiate regular workplace assessments, be alert for suspicious behavior, maintain behavior that helps to diffuse anger. If you cannot diffuse the situation, remove yourself and call security, and also know your patients. So let's talk about the procedure when dealing with violence. Report to your supervisor. Report threats as well as actual violence. Call the police, get medical attention, contact your collective bargaining unit or state nurse association. You want to be proactive when it comes to violence. You think that bullies would have ended in grade school, but unfortunately there are even bullies in the workforce environment. We are going to talk about some ways that you can deal with bullies. Assume that all fish are sharks. Assume that they do not bleed. Admit it is difficult not to bleed, but know that you can. Make sure to counter any aggression promptly. Avoid ingratiating behaviors. Be sure to respond to all inappropriate behaviors appropriately. And make sure that it is known that the behavior is unacceptable and will not be tolerated. And unfortunately, the workplace can also experience sexual harassment. The ANA tactics to fight sexual harassment include confront. This indicates immediately and clearly to the harasser that the attention is unwanted. Then report the incident immediately to your supervisor. If the harasser is your supervisor, report the incident to a higher authority and file a formal complaint. Then you want to document. You want to document this incident immediately while it is fresh in your mind. What happened, when and where it occurred, and how you responded. Name any witnesses and keep these records in a safe place away from work. Then seek support. This can be from friends, relatives, and organizations such as your state nurse association. And as an employer or manager, it is your responsibility to maintain a harassment-free workplace. Most organizations have a no-tolerance policy. Working in the healthcare field, another potential safety hazard places staff at risk for needle stick injuries. As you may recall, needle stick injuries occurrences were discussed in previous courses. For a workplace safe environment, needle stick injuries employers' responsibilities are to offer free Hep B vaccines, provide protective equipment that fits you, provide immediate confidential medical evaluation, treatment, and follow-up if you are exposed, have adequate sharps disposals, have proper removal of hazards from the workplace, and have annual employee training. Now we're going to discuss some other workplace safety issues. We can have ergonomic injuries. These are back injuries, repetitive stress injuries, or toxic environments. And then we could have the possibility of working with impaired workers. There's a potential for microbial threats such as biological or chemical. Then we have the concern with rotating shifts. Just think about it. If you worked overnights, just 8 hours per se, but you did the night shift, and then you went home, by the time you actually get home, you actually get to sleep, and you're expected to come back to work and work the evening shift, you're not going to get the full adequate sleep that you need. Then you have the safety issue of mandatory overtime. Think about it. Say you just worked 12 to 16 hours and your relief didn't show up. You can't leave. You can't abandon your patients. You're already tired. You're exhausted. You want to go home, and you're going to have to stay there and wait until you have your, they can get somebody in to take your place. You're not going to be really focusing on your job duties or the patient. Another safety issue is staffing ratios. Unfortunately, at this day and age, staffing is based upon a number system. It depends on so many patients per so many staff members. It's not based upon acuity or the care that the patient actually needs. Now let's change our focus from safety issues to quality. We are going to discuss the social environment and professional growth and innovation. The social environment includes working relationships, support of one's peers and supervisors, and involvement in decision making. In a supportive environment, people are willing to make difficult decisions, take risks, and go that extra mile for team members and the organization. For professional growth and innovation, some of the ways managers can develop and support a climate of professional growth are to encourage critical thinking, seek out educational opportunities, encourage new ideas, and reward professional growth. In the workplace, stress is related to a mismatch between an individual's perception of the demands that are being made and their perception of the ability to meet those demands. An individual's stress threshold also depends on the individual's characteristics, their experiences, their coping mechanisms, and the circumstances of the event. So some of the sources of stress can be related to conflict with physicians, work overload, work devalued, role conflict, ineffective, hostile, incompetent supervisors and or peers, lack of personal job fit, inadequate preparation, recognition, or clear job description, poor work control, fear and uncertainty related to career progress, age, gender, racial, or religious discrimination, dealing with death and dying patients and or families. Salary. Terrorism, changes in technology, downsizing, constant changes in the nursing care delivery, work or home conflicts, elder and child care issues, lawsuits related to job stress, demands of accreditations or compliance issues, pressure for immediate results, or even colleagues' inexperience. So now we're going to review some other stressors of professional ideas and work realities. The professional idea is to have comprehensive holistic care, emphasis on quality of care, explicit expectations, balanced and frequent feedback, and assignments that make sense. What we tend to get in work reality is mechanistic, fragmented care, emphasis on efficiency, implicit or unstated expectations, intermittent or often negative feedback. Having realistic expectations of yourself and your new profession will also reduce stress that's related to unrealistic goals. You must develop good coping methods. Unsuccessful coping methods usually result in abandonment of professional goals, giving up professional ideals, or leaving the profession altogether. So think about it. A moderate amount of stress can actually stimulate high performance without detrimental effects. Who would have ever thought that stress was actually good for you? When feeling a little overwhelmed, you want to focus on the good of stress. You can do this by developing a professional identity, learning about the organization, use your energy wisely, communicate effectively, seek feedback often and persistently, develop a support network, and definitely find a mentor. Qualified mentors can assist in relieving stress. So, an effective quality mentor has excellent communication skills. They show sensitivity to the needs of nurses, patients, and workplace. They are able to encourage excellence in others. They are able to share and provide counsel. They exhibit good decision-making skills. They show an understanding of power and policies, and they demonstrate trustworthiness. A mentee must demonstrate eagerness to learn, participate actively in the relationship by keeping all appointments and commitments, seek feedback and use it to modify behaviors, demonstrate flexibility and the ability to change, be open in the relationship with a mentor, demonstrate an ability to move towards independence, and be able to evaluate their choices and outcomes. Do you ever dread going to work? You think frequently about mistakes or failures, avoid patients, colleagues, or assignments, use alcohol or drugs to relax after work? If you are experiencing any or all of these signs, this indicates your stress level is way too high and you may be approaching burnout. The aspects of burnout are high expectations and idealism, pessimism and early job dissatisfaction, withdrawal and isolation, irreversible detachment and loss of interest. The stressors that lead to burnout are personal factors, job-related conditions, human service occupations, conflicting demands, technology, or even the lack of balance in life. Ultimately, you are in control. Every day you are faced with choices. By gaining power over your choices and the stress they cause, you empower yourself. People cannot live in a problem-free world, but they can learn how to handle stress. So let's get back to our ABCs. The ABCs of stress management are awareness. Life's demands and changes and your own idealisms and capabilities. Be aware of these. Believe in your ability to cope with these demands and changes. Look at them as challenges instead of threats. Have a commitment to work as an active participant in life rather than alienating yourself. So let's talk about some activities that you can do to maintain physical and mental health. Deep breathing. Good posture. Get plenty of rest. Relaxation. Give yourself a timeout. Proper nutrition. Exercise. Set realistic expectations. Reframing. Humor. And social support. This concludes the lesson of a healthy workplace, stress, and burnout. If you have any questions that are related to the course content, contact the instructor.